Thank you for joining us to discuss using Aquifer during the transition to residency. Aquifer cases walk learners comprehensively through each step of a patient encounter, from history, physical and labs, through developing a differential, ordering additional studies, forming a final diagnosis, then treating and managing the patient. Throughout this process, core content learning objectives are met through meticulously mapped teaching points, such that by the end of the course, all of the relevant national objectives have been covered. Cases provide in depth and engaging teaching along the way, much as you would expect from an expert preceptor, asking students questions to check and correct their knowledge before moving to the next step. Educators often share that they assign students cases containing topics normally covered during the didactic session. Classroom time then goes deeper into a topic, whether discussing different but related cases or discussing actual patient encounters related to aquifer cases. We know educators are busier than ever, which is why we've created the AI Assistant chatbot. Educators often ask, how do I find the right cases? What's the best way to integrate them in the curriculum? The chatbot answers these questions instantly, no waiting for email replies or searching through documentation. Simply type your question in the text field, and the chatbot will recommend aquifer cases for your clinical rotation or course, provide strategies for using cases in small groups, flipped classrooms, or independent study, and help you plan a course with the right cases across your curriculum. We know there are circumstances in which educators want to have a greater ability to filter and retrieve case results. The content library provides advanced content searching across all cases and or integrated illness scripts that are aligned to your subscription. The detailed content list displays information including synopses, case summaries, learning objectives, and integrated illness script mechanism of disease maps with one click. The content library includes a series of drop down filters, including clinical discipline, body system, patient age, location, clinical focus, and the aquifer content aligned to your subscription. You may also search by condition and diagnosis, basic sciences if your subscription aligns to that, as well as clinical excellence curricular threads should your subscription align to that. Aquifer cases and scripts are written and continuously updated by expert health profession educators who make up the Aquifer Consortium. The date the content was last updated are displayed for each item, so you can be sure your students are being provided up-to-date content written by your trusted peers. Consider using Course Builder to assemble your case and script choices into one package, or Course Builder. You can assign specific aquifer cases and scripts to students, track your class or cohort progress at a glance, and include course-specific information or directions for students. Save time by using our duplicate course feature, which allows you to copy content and or users to a new course. The QR code will take you to the webpage with more specific step-by-step details for creating Course Builder. So how are programs using Aquifer during this transition phase? One Midwestern medical institution incorporated Aquifer's diagnostic excellence cases to explicitly address why diagnostic errors occur, how to respond when they do, and importantly, how those errors can be prevented before learners enter residency. The Diagnostic Excellence case set includes a foundations module and 6 virtual patient cases. Together, these cases give learners repeated, realistic practice with clinical reasoning while also drawing attention to the system factors that influence diagnostic safety. When we think about transition to residency, there are several ways programs are using these cases. Selected cases can be assigned as pre intern preparation, so learners arrive with fresh clinical reasoning practice and a guided reflection on common diagnostic pitfalls. During boot camp, ready made activities can support small group debriefs. These sessions help interns practice talking through uncertainty, recognizing when to pause, and articulating their diagnostic thinking. The cases also work well as on call prompts, asking learners what they would do with limited information, how they would escalate care, or when they would stop and reevaluate their approach. Faculty can use the case analysis tool to create a consistent structure for feedback, particularly around differential diagnosis and decision making. Finally, some programs make one diagnostic excellence case a monthly through line during the first quarter of residency. This keeps clinical reasoning growth visible and helps normalize reflective learning early in training. At a Pennsylvania healthcare system, a residency director created a 2-week radiology boot camp using Aquifer radiology cases to address the wide variation in experience among incoming residents. Modeled after his own training experience, the program provides a shared baseline of radiology knowledge at the start of residency. Residents complete 2 Aquifer radiology cases each night, which are then used in live sessions using radiology's flipped classroom workshops. Senior residents led most of the teaching, with faculty supporting subspecialty topics. The ready to use workshop slides and notes minimize preparation time and make it easy for residents to step into teaching roles. Incoming residents praised the program for clarifying expectations, building confidence, and fostering community. Senior residents reported that teaching strengthened their own knowledge, supported board preparation, and helped them develop teaching skills. Overall, Aquifer Radiology provided a flexible, low barrier framework for building knowledge, teaching skills, and community within the residency program. Orienting your students to Aquifer will make a big difference in their learning experience. You can help them maximize their learning by sharing some key information to help them get started and understand how Aquifer fits into your plans for your course or clerkship. We've created slides with the basics on Aquifer cases and useful tips for students, ready to drop into your course or clerkship orientation. Using this QR code takes you right to the PowerPoint slide deck. We're excited to offer you a personalized session with an experienced health professions educator who actively uses Aquifer in a variety of learning environments with different levels of learners. Curricular consults can cover a range of teaching suggestions, integration strategies, and guidance. Each consultation will be customized to your specific needs, with the goal of getting you quickly up to speed and making the most of your subscription. Scheduling a consultation is quick and easy using this QR code, which takes you right to the scheduling page. We look forward to connecting with you soon and learning more about how we can best support your curricular needs.